Hello, 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 everyone. I'm Dr. Perkins, a board-certified OBGYN, and today we're talking about a natural remedy for yeast infections in men. Now, if you've ever wondered, can men get yeast infections as well? The answer is yes. And so today we're going to talk about what is Candida balanitis. What are the biggest risk factors? What symptoms should you be aware of? And then we'll talk about several remedies and red flags that you should know when it comes to yeast infections in men. Now, what is Candida balanitis? That is the medical term for a yeast infection in men. This is an infection of the head of the penis. This is an infection that is caused by a fungus. So you may have heard the term yeast infections before. If you're a female watching this, you've perhaps heard of or maybe experienced it yourself. And if you're just concerned about your partner and whether or not they can get it or if they currently have one, this is the video for you. Balanitis is a medical term that means inflammation off. Now, when we think of inflammation, it can be caused by a lot of different things, from infections to bacteria to fungi, all types of things. When we think of Candida balanitis, Candida is actually the term for yeast. That is the term for a specific type of yeast that can cause these fungal infections. Believe it or not, these infections, or Candida balanitis, are actually common enough in men. In fact, about 1 in 25 men may experience this infection in their lifetime. And as we talk about statistics, about 1 in 30 who are uncircumcised may experience this as well. So the biggest risk factors here are, first, being uncircumcised. It is the top out of all of them. A part of the reason is because when the foreskin of the penis has not been removed, it actually works to be a really nice for infection. Things can be trapped beneath the skin. That area becomes really warm and really moist. And so it is like the perfect environment for things to grow. Another risk factor is being a diabetic. Diabetes truly is a condition that leaves your body not in its best form. What can happen is that when you have diabetes, even though you might not feel pain and have things that sparks a problem every day, most people slowly actually are having issues with their glands, all of their glands in their bodies, from their brain, their heart, their lungs, their muscles, their joints. And what happens is that your body is not processing things well. And so you're in a place where your body and your organs are inflamed. They are very vulnerable to different infections and things. And so specifically with diabetes is where your body is not processing sugars very well. And when sugars hang in the system, it allows your body to break down, or it makes your body break down slowly over time. And so with that, when more sugar is available in your body, the risk of diseases will increase. So when we think of infections, the same happens. Infections, bacteria, fungi, parasites, all of these things love sugar. That is like food for these parasites and bacteria and different organisms. With yeast, it is no different. We've seen, and there's so many studies that have been published that shows that people who are diabetic have an increased risk of infections, including yeast infections. And so when we start talking about possible things that you can do naturally to help, we will come back to this topic. The next risk factor that I have to mention here is the use of antibiotics. Yes, whenever we use antibiotics, we increase the likelihood of getting yeast infections. The reason is antibiotics, as great as they are wonderful for the infection that they are meant to treat or fight. However, if you are taking antibiotics over time, antibiotics will kill the good and the bad. And so when we lose some of our good bacteria, it allows our other bacteria and our safeguards to be lowered. And so because of that, infections like that of a fungus, like a yeast, tends to increase after antibiotics use. As a provider myself, I often will provide treatment to my patients for a yeast infection just in case it happens, because the likelihood of it happening is so high that I prep and prime my patients from the beginning that, hey, this is a risk. Here's some medicine to help you just in case that were to happen. Because of this, it is one of the top 3 things that I think are the greatest risk factors for a yeast infection, even in men. The symptoms of a yeast infection in men are actually quite similar to that in females. Redness, itching, burning, noticing a discharge or an exudate is what we'll call it, but essentially things that would be like layered on the skin. That is white, clumpy, a very thick texture, could be a sign of a yeast infection. Some men may specifically have an odor that is new, may have maybe pain with sexual activity, or even pain with urination. And so if you're concerned, well, how do I know whether or not this is a yeast infection and what do I do about it? There are a few things that you should know. Now, the first thing that I want to preface here is that a majority of the studies and the data that we have available on both natural remedies and true remedies for yeast infection were actually done with females. And I mean, it makes sense because a majority of females will deal with a yeast infection at some point in time in their lifetime. And so with men, these infections are a lot less common. And so we can presume that the things that would work in a female may also work in a man because we don't have a lot of data to actually show for any of the remedies that we may use. So the first remedy that I would mention is making sure that our sugar or glucose, if we're diabetic, is within a normal range. If we do not have excess sugars hanging in the body to feed the yeast, then the likelihood of an infection, a recurrence of an infection, and having trouble with treatment is actually much less. The second thing that I would mention is making sure that our hygiene is on par, okay? That means we are washing regularly. If we are uncircumcised, that we're peeling back the foreskin to make sure that we're cleaning beneath the skin well. It's also making sure that the products that we're using is not too strong and definitely not antibacterial. You know, so many patients think that anything antibacterial is just so good for the skin. It's like the best thing that you can do, and it's actually the worst thing that you can do for your body for the same reason that I mentioned earlier, where we kill the good and the bad bacteria and our body's defense system kind of breaks down. The same thing happens when we use antibacterial soaps. Another thing that I would mention here is that we should wear breathable clothing. Cotton material, especially by the genitals, this is like the best thing that you can do for yourself. And the same thing applies to a female. If you've been here on my channel for a while, or if you're new here, you may be aware, I've talked about yeast infections and treatments for both females and males on this channel before. And so if you're interested, you can always check out some of the other videos that we have here, because it may go into this topic a little bit deeper and answer a few more questions for you. The last remedy that I would like to mention today, and there are so many more, but the important ones we're talking about today. Number 3 is the use of probiotics. And when I mention probiotics, really, I would want to encourage probiotics and prebiotics. There are lots of studies that have been done on probiotics and those that are specific to the vaginal area. And we know that there are benefits to using probiotics. Essentially, these are cultures. These are good bacteria that you're presenting to your body to help your natural microbiome thrive. And so we anticipate and we presume that the same benefits would apply to a male. Now again, there are not a lot of studies out to support with evidence-based medicine, but we presume and we think that there would be some benefit to using probiotics. Now, there are times when going the natural route is really not the best route to go. We know for a fact that the treatments that we have available for yeast infections work, whether they are the over-the-counter ones or the ones that are prescribed. Again, you can check out some of my other videos as I delve into all of this information. But if you have recurrent infections, if you're having worsening pain, If you are concerned that you're not able to urinate well and you might be retaining a lot of urine, these are red flags that require going to a doctor and being tested and getting a prescription. Definitely if you're having fevers, chills, and any sign of like systemic infection, we definitely need to be seen, and we should not go the route of going natural. If you're dealing with these symptoms or even hormonal issues and you're wondering whether or not you have an underlying hormonal imbalance or PCOS or diabetes, and you just need help with how to approach allowing your body to thrive in its own natural state, this is what my ebook is all about. It is called Hormones Don't Lie, and I would love to send you a copy. The link is right below. Now, if this information has left you with more questions, or you're eager to learn a little bit more, there are a few more videos that I think might help you along your journey. The links are below in the descriptive area, so go ahead, click and watch and learn. This is what we're here for. I'm Dr. Perkins. Thank you for being here.